A new question, the member from Davenport.
Thank you, Mr. Speaker. My question this morning is for the Minister of Health and Long-Term Care.
Great, Minister.
Providing all Ontarians with timely access to the care they need, whether at home, in their community, or in one of our outstanding hospitals, is of the utmost importance to our government, but also to me as the member of Davenport. Over the past 14 years, Ontario's healthcare system has improved tremendously. We've increased our investments in health each and every year, allowing us to treat more patients, provide better care, and reduce wait times to some of the shortest in the country. More than 1 million more Ontarians and 94% of all Ontarians now have access to a primary care provider. We've gone from worst to first for reducing wait times, including hip and knee replacements, cataracts, cardiac care, radiation oncology, MRIs, CT scans, and ultrasounds, as noted by the Wait Time Alliance. And I know that our government has increased funding for health care by $23 billion since 2003. Can the Minister of Health and Long-Term Care please inform this House of the achievements our government has proudly made?
Minister of Health, Long-Term Care.
Thank you, Mr. Speaker. I appreciate the question, and I first want to, because we are in the middle of Mental Illness Awareness Week, I want to not only acknowledge that and how critically important our supports for those who are suffering from mental illness are, and the fact that there can be no health without mental health, Mr. Speaker. It's that important. And I want to acknowledge and, in fact, celebrate and thank the mental health leaders. Many of our mental health leaders are here with us today. Mr. Speaker, we have increased funding every single year we've been in office to the health sector, and we're building on these important investments by increasing investments in hospitals, in long-term care homes, in home care, in community care, in mental health. And that includes the investment this year and last year of $1 billion added to the operating costs of our hospitals, $20 billion over the next decade in capital investments. Mr. Speaker, we'll continue to make the investments required to ensure that, as third parties are telling us, we have one of the best healthcare systems in the world.
Supplementary.
Thank you, Minister, for setting the record straight in this House. I know health care is a top priority for our government, and I'm pleased to know of one of the greatest investments that we're making in our province's hospitals. But I also know that our government is doing more than just investing in hospitals, Mr. Speaker. Our government has made a commitment to providing Ontarians with the support that they need to create a truly accessible, integrated health care system for all Ontarians. Can the Minister of Health and Long-Term Care please inform this House of the investments the government is making to expand accessible care for all Ontarians going forward?
Thank you. Minister of Health.
Well, Mr. Speaker, 14 years ago, during their tenure, the PCs closed 10,000 hospital beds. And, Mr. Speaker, during their tenure in the 1990s, the NDP closed 9,645 hospital beds, Mr. Speaker. In the last several years, we have added to the complement of acute care beds by nearly 1,000, Mr. Speaker, in just the last several years. Since 2003, the number of physicians has grown by more than 6,000. In fact, it's growing at 3 or even 4 times the rate of population growth currently, Mr. Speaker. We have 28,000 more nurses, including 11,000 more RNs. That includes 2,642 additional nursing positions created over the last year alone, Mr. Speaker. I think we can all agree that even that one statistic is a remarkable achievement, given that the previous PC government fired 6,000 nurses, Mr. Speaker.
Thank you.